Morning, everybody. I'm Dr. Willardsen, and we're here in beautiful Newport Beach, California, for the Trust Implants Livestream. And today we've got a really good show for you that we want to talk about all things related to patients that are in need of dental implants, dental implant reconstruction. So whether you're losing your teeth, missing your teeth, or in a situation where you're feeling self-confident about your smile and not able to present yourself to the very best situation possible. And so today we're going to talk about some of the logistics about the process. Many patients and many comments that we get on our channel are simply related to that. You know, they are considering the process, or they've been through the process, and they have questions as to what to expect. I often liken the process to flying to the moon. Until you've done it, you have no idea what it's like. And so, you know, I've never been to the moon. I can imagine what it's like, but until I would actually make the journey, I could not describe, I couldn't explain, I couldn't even fathom where to begin on what it's, you know, what that is like. And it's very similar for patients who are losing their teeth or have lost their teeth or are considering reconstructing their mouths. They have no clue what it's like, and oftentimes they are dictated by the doctor who is managing their case. And so, and even then, the doctor hasn't, quote unquote, flown to the moon either, because they've never had this procedure done for the most part. Most dentists have not lost all of their teeth and have ended up with a all-on-4, all-on-6, or some sort of an implant fixed prosthesis. So, and so oftentimes even the doctor can't really relate or effectively relate what it's like having gone through this process. So again, I apologize for starting a little bit late. This is a very important topic. I wanted to make sure that we have everything lined up so that we can portray the message that we want to portray. It's a bit challenging because I'm literally in surgery every single day, so by the time Wednesdays roll around, they come really fast for our live streams. And you know, it's not that it's thrown together, because my methodology, my thoughts, my photography, videography, and the content that I have is very, very precise. It's just my ability to organize it and put it together in an effective manner, and then get it ready for the Wednesday morning live stream. Sometimes falls through the cracks. So again, I apologize for that. However, this is important information. It's you know, we're almost creating topics on situations and scenarios that right now don't necessarily exist on YouTube or online. You've got a lot of content creators and dentists who are talking about the cost of implants, or different implant prosthetics, or whether it's a snap-on denture, whether it's a fixed denture, whether it's all on 4, whether it's all on whatever. But that's doesn't really delve into the specifics of the process. And again, I'll use the flying to the moon analogy. Me describing a snap-on denture versus a fixed prosthesis on a number of implants, whether, you know, here we don't do all on 4, we do minimum of 6. But, you know, it doesn't describe the intricacies of the process. You know, again, as we spoke about in our last live stream, you know, for me, the thought of having my teeth pulled and then having implants placed and some form of a prosthetic to replace those teeth, you know, for me personally, that is not something I would ever want to have to do myself or have done on myself. But there are those cases where there's just no other options. And implants are an amazing alternative for those patients who have lost their teeth or are losing their teeth. And implants are the only solution. It's the only option that we have today. And patients will ask me, well, can't they grow teeth in the lab? Actually, they are growing teeth in a lab, but they are only growing, for example, in a tooth, you've got dentin, you've got enamel, you've got the nerve, you've got the periodontal ligament, you've got so many aspects in the anatomy and the morphology of a tooth that God created that will never, ever, ever, ever be replicated. It just will not be possible. Yes, you can replicate enamel. Yes, you can replicate dentin. Yes, you can replicate, an aspect of a tooth, but can you replicate the design? Can you replicate the periodontal ligament? Can you replicate how it's inserted and integrated into the bone? Can you replicate the way it fits into that person's mouth and the dimensions of that tooth for that person's, like a central incisor for that person's face? No, not going to happen. Never will happen. No matter what you read in the fake news, you're not going to have a tooth that is grown in the lab to replace teeth that are lost or missing. Not to mention lost or missing bone and tissue and anatomy and architecture. That will never be replaced. So the only thing that we have to date are dental implants. They're wonderful. They do provide such a wonderful service for patients that are an anchor that will support, maintain, and hold a artificial prosthesis that is made out of a organic substance. It's zirconia, or in the all-on-4 corporate implant centers, the choice clearance centers, or some of these other centers where you get a plastic teeth on a titanium bar and they put in 4 implants. And that's the best they can do. So, and that's kind of the norm in the marketplace right now. So, with all that being said, as we sit here, the very best thing we've got is to replace teeth that are lost or missing. And oftentimes they are lost or missing as a result of dentistry, whether it's root canals and bridges. And I mean, just this week I had to extract on multiple patients 3 different cases, but single natural tooth that had a root canal. One of them was just about 3 weeks ago, the root canal was done. And younger lady that, had the root canal done, spent the money on the root canal, spent the money on building the tooth back up, spent the money on the crown, and then literally 3 weeks later goes back to the endodontist or the guy that does the root canal. Endodontist says, oh, you know what, Mrs. Smith, I'm sorry, but didn't work. We've got to pull the tooth out. So that begins a whole nother process, a process in which now we're extracting the tooth, regenerating the bone, doing a bone graft, building that bone back up, and then ultimately replacing the tooth with a dental implant. And, I haven't really explained, what is a dental implant? I assume most people know what that is. It's a titanium screw that's screwed into the jawbone, and then a abutment screws into the implant, and then a crown is placed on top of, or oftentimes in my practice, we'll use a screw retained crown to where we have access to the crown. We can take it on and off as needed. And that's just one tooth. So now think about reconstructing a whole mouth of teeth that have been lost, and with these artificial materials. And again, like I say, it's remarkable, and to me it's God's hand in allowing, or the body accepting and receiving these foreign objects, a titanium implant, and that the bone integrates heals, and it becomes part of that person's mouth and bone and tissue so that it can withstand the loads. So again, that 450 Newton pounds per square inch, every time the patient bites down, these dental implants can handle that sort of a load if done properly, and if the case is designed properly. Those load factors are distributed throughout the arch so that these implants that are, the largest diameter implant, even a 5.5 millimeter implant, that's very big. Here we tend to stick towards like a 5.0 millimeter or a 4.3 millimeter, and then you've got the length of the implant dependent on if we're trying to avoid certain anatomical landmarks, for example, the nerves, intraalveolar nerve, the mental nerve, posterior maxillary sinus. We determine the length of the implant based on the available bone. So the longest you would want to use is about a 13 millimeter. Anyways, that's a little backstory on, the beauty of the third set of teeth, which is dental implants. And so the fact that we have them and that we're able to reconstruct and rebuild somebody's mouth who has lost their teeth and is now either stuck in dentures or oftentimes no teeth at all. And if you can imagine trying to, this past week went to which is kind of outside of my nature, but we went to a symphony here in Orange County, and we go to dinner, and there's lots of, people in their gowns and dresses and tuxedos, and very, kind of a high-end situation. And I can't imagine somebody going to a scenario like that wearing dentures, and they're sitting there trying to be all proper, but their dentures are flopping around, and they're trying to be discreet about that. So, that's kind of on the extreme. But even just, going to a restaurant that's not that nice. I mean, it's for those of us who have teeth, for those of us that don't have these issues, we can't even relate to the people who are dealing with losing teeth or wearing dentures on a daily basis. So, so I try to put myself in their shoes and imagine how it affects them on a moment by moment basis. It's not just when they eat or, when they meet somebody for the first time, or when haven't seen their grandkids for a while and they are, and the denture thing is always in the back of their mind. Oftentimes when we meet these people, we don't even notice. We don't think about it. But in their mind, that's all they can think about. So anyways, my point is that, we have the technology, we have the ability, we have the option, we have every possible solution to help these patients in restoring their mouths and ultimately restoring their lives to the most ideal scenario possible, given the fact that they do not have their teeth anymore. So that being said, last week we had talked about a case. I'll just pull up the x-ray real quick. And this is the kind of the pre-operative or the x-ray before. And this patient has been through so much. He's, if we look at this image, hopefully you can see that on, you can see this image, but, there's crowns, there's bridges, there's natural teeth, there's implants, but more importantly, the mechanics of this situation is completely unfavorable because everything is right in the front. So the only place in this image that the patient can chew is right in the front. And so ultimately the teeth were removed, and the patient ended up with a full set of implants. So hopefully I can make this bigger. Let's see, here we go. All right. And so now we have options. We can attach the prosthetic to these teeth. We can make it, we have anchors that we can attach to so that we can start the process of, getting him to a place where he has teeth. And I will go to the images where he actually does have teeth. And so you can see here, and these are just temporaries, but you can see now the teeth are in place. We're still in the process of fabricating the final set of teeth. And I would like to have this patient come in so that we can talk about his journey and what it's taken for him to even get to this point. And I call it heart tissue burn. So whenever I'm in surgery and I'm in a 9-hour case or whatever the case may be, I'm actually burning heart tissue. It's stressful, it's intense, I love it. However, when I come out of the OR and I've been in there for 9 hours, I'm pretty wiped out. And it's a process of, I call it burning heart tissue. So whenever I say that, it just means that I'm in a very intense, highly stressful situation and doing everything I can within my power by the help of God and being able to get all of my patients, including my patient here, on the path to recovery and on the path to not having to deal with this issue anymore. Because once we've completed his case, even though they're on implants and they're not his own natural teeth, he will be on the path and on the road to recovery, so to speak. And again, I liken it to losing a limb. If you were to lose an arm or a leg, once you have it restored and you're able to utilize it, your life has changed. It truly is. And the mouth is absolutely no different. In fact, it almost gives more because aesthetically, your confidence, your self-esteem, the ability to chew your food up and digest your food increases tremendously. So many benefits to having gone through this process. So I would like to introduce my patient here and have him talk about his journey, because it's been quite a journey. And in fact, it's remarkable that he's made it this far. He's come from back east to California and started the process in his hometown, had not found a resolve that was up to his standard, and he's done plenty of research. He knows what he wants, and he's on a mission to achieve and get what he wants. So I'd like to introduce Mr. Strum and to have him describe his situation from A to Z, and keep in mind, he has been through a lot, and there's just no way to put into words the what he's been through. And I know that he may be I know that he'll be able to describe, and I know that there are lots of viewers out there who are in a similar situation that I feel can relate to what he has been through. Well, actually, I don't know that because he has been through a lot. And so I'd like to introduce Matt Strum. Matt, come on in. All right. How you doing, my friend?
I feel pretty good.
Good.
Knowing that I'm sitting here.
Yes, sir. Yeah. So, Matt, tell us. Let's go back. A few years back, and kind of give us a little bit of history on how this all transpired. So first, when did you start losing your teeth?
Like you were talking about root canals. I've had numerous root canals on my natural teeth and had crowns on them, and veneers. That's where the trouble started, was with the veneers.
Okay.
The natural tooth.
Right.
They were up here.
Yep.
The tooth is already thin because they ground it down.
Right.
And that was first to break off, gum level.
Yeah.
So thousands and thousands of dollars later, for one, trying to save that.
Right.
Then the next one broke off.
So it was just one, and then
Then
another.
another. The veneers.
And another, right.
Yes, and then a year or two later, the root canal teeth started to fracture
Yeah. Yeah.
because there's no blood flow to them anymore.
Exactly.
And,
So as we talked about, I think in our last live stream, you know, whenever you have a root canal, you've removed the blood supply, you've removed the nerve, and so the tooth actually becomes brittle.
like a
So-
tree stump, exactly what it
exactly
comes like.
Like a dead tree. Yeah.
It might look good for a while,
Right.
but then it starts flaking off. That's what
Yeah,
was happening to
breaking
my
down.
mouth.
Yeah.
So my general dentist, very nice man,
Mm-hmm.
he was my dentist for a long time, 20 plus years, and
Right.
sent me to the oral surgeon,
Yep.
and where the veneers broke off, and put an implant.
Right. Right.
So I started with one. That was in 2017.
Okay.
So then, like I say, it wasn't shortly after that. While that one's healing, the other one broke off.
Broke off. So here you
So
go.
I
another
kind of
one.
made the decision. I don't want to spend thousands of dollars just trying to save that. Let's
Right.
just get another implant.
Sure. Right.
So then that's when you've seen one implant, then two, then maybe three. So I ended up with three on this top side because the root canal one also fractured and broke off.
Right.
I said,
Uh-huh.
let's just put another implant in.
Right.
So that was 2017, 2018, and 2019.
Right. Right.
And still had nothing in place on those.
On that side.
Just those implants were hanging there.
Right.
So now I'm eating all on the front here.
Real quick, tell me
Right.
a little bit about your background. Like where did you grow up?
Okay. I grew up in Massillon, Ohio.
Ohio. Okay. Uh-huh.
Went to high school, Washington High School.
In Massillon.
In
Ohio?
Massillon, yes, sir, yes, sir. And I am a local independent plumber. Been doing it for 38 years.
So you understand the intricacies and the detail of even this type of work. I mean, plumbing, I'm sure, is very detail oriented.
It
I mean,
is.
if you miss something, or if you don't, put something in correctly,
Yeah, flood your
it
house.
can have
You can have a flood.
drastic effects.
Drastic
right?
effects,
Like
for
you
sure.
can flood their house, cause who knows what, a whole host of damage to their
Millions
house.
of dollars worth of damage could be done by water.
If
for
you
sure.
don't plan correctly and execute correctly, correct?
That is a given.
Yeah. And I'm sure that your level of stress when you're in that environment and you're down in the ditches, correcting or fixing somebody's plumbing, in your mind you're constantly thinking, okay, whatever I do here, whatever I touch here, I have to use my expertise to make sure that 5, 10, 15 years down the road, and maybe it's less than that because I don't know how long plumbing lasts, but you're going to do everything in your power to make sure that the work that you do is going to stand up to your ethics and your gut, right?
Yes,
so
sir.
that when that person pays you, you feel good about it, you sleep well
Absolutely.
at night, and you're off to the races and off to the next job.
That's why I've been in business for over 37 years, because I do my own work.
right.
I don't let anybody touch anything that I've been hired to do.
Right,
And
right.
there's a reason for that, because like you were saying, I know what I want done,
Yep.
and I do it the way that I know it needs to be done, and it will more than likely going to outlast me.
Right. And the people that you work for, they just trust you. They're not
sure.
going to question, well, Mr. Sturm, you used this pipe in this room. I don't know about that.
No. I have customers that I've had for 25 years.
Right.
They repeat,
They just
repeat,
trust-
and their family call me,
Right.
and their cousins call me. It's because not only they trust, but they know that I'm going to do the right thing.
Exactly.
Just
And
like
that's
you,
why
doctor.
they keep coming back.
Just
right?
like you. That's why I'm here, because
That-
I know that you can fix my mouth.
Yeah, yeah.
That's
And
why.
so those customers keep coming back because they can trust you. They know that when Mr. Sturm shows up to their house with a plumbing problem, A, that problem's going to be fixed, and B, it's not something they need to worry about, right?
99% of the time,
Yeah.
there's no question. They don't question me. They don't ask me what I'm using.
Absolutely.
They don't helicopter over top me.
Yeah.
Lots of people give me the keys to their home,
Yeah.
their garage door opener because they're working, or they're
Yeah.
doctors or lawyers, and they're in hospitals.
Right.
It's amazing what I can do.
I can imagine. I
It
can
is.
imagine that
You can Google me, and you can read all about me.
I've come to know you, and I know that you have a high level of integrity, and the people that you serve are well served.
True.
Now, that being said, you also have, had some issues with your mouth.
That is correct.
And ended up at, a dental office here or there, and kind of fell into the same sort of thing that your clients fall into, in the sense of, you showed up, with this scenario in
Put
your
it
mouth.
this way. I've been out here for what now?
6 weeks?
At least 6 weeks. I have customers waiting on me, so
I
they
know.
will call nobody else.
I know that.
Just to let you know.
I know.
But yes, the issues with my mouth are extreme.
Yeah. My point with that is the same way that your customers trust you, you ended up going to the doctors that you trust and that you put you don't know what type of plumbing they're using or implants they're using, or you don't know what you can get an idea, but you don't really know what their ideas are and the long-term end result of the final set of teeth. You just want teeth back, correct?
I have found out the hard way, doctor, and it really just tears me up.
Yeah.
I'm devastated with my mouth at this moment. I have been left with no teeth for 4 years.
And how have you managed with no teeth for 4 years? What does that look like on a daily basis, and at night? Because having no teeth
Doctor,
at night,
it is. The word I could use would be it's unbearable. The stress level that comes from me looking this way, and I have paid those dentists, and they have left me with nothing, no teeth, and no explanation, except that could not satisfy me. I don't know what that meant, but that's what it came down to. Couldn't satisfy me. I would never tell a client of mine of any such word would that come out of my mouth.
you would.
I would do
go,
anything. I'll go
to
the
all
end
ends of the earth
to fix their
to fix
problem.
and satisfy
And
them,
another
right?
thing, when I do work for people, I don't take a penny up front. I was made to pay those other prosthodontists in Ohio up front in
Yeah.
full. And they did nothing but take a couple x-rays. I'm devastated.
Yeah.
I'm almost
I
speechless.
understand.
My mind is racing 24/7. My poor wife, we've been married for 40 years. It's terrible what she's been through, what my children have been through, what I've been through. It's very hard on me. I try to keep it under control. The embarrassment. We haven't went out to eat, to dinner, have a good time. Not only the embarrassment, you cannot chew food without teeth.
Right.
It's
obviously.
just impossible.
Right.
So you either have to sit there and you got to cover your mouth, and you got to try to hide what you're doing on your plate to smash some food. It's just the stress that comes from that alone it's unbearable to me.
Yeah.
Some people don't care that they
Yes.
have no teeth
Right.
because they have no means to
To fix it.
get it. They have nobody to turn to.
Right,
They're
right,
lost.
right.
So I try to educate myself.
Yeah.
Even though I'm a
Which you
plumber,
have.
I'm not a dentist, but
Right.
I've read lots of books and watched lots of videos and doctor shows of numerous dozens of dentists through the United States. But you're the one that stood out to me. When I watched you doing your work, I told my wife, I said, that is where I want to go. This was almost 5 years ago.
Oh,
I told
really?
her that, yes.
Oh, wow. Yeah. Okay.
But my dentist, local, they persuaded me to stay in town, to stay local. Yes, it's a long way to come from Ohio to here. I
Absolutely.
drove out here. I
know.
can't fly on an airplane.
I know.
I just couldn't do it, so I drove my
So
vehicle here.
what's the, how long does it take to, how many miles is it from Ohio to Newport Beach?
It's up there, close to 3,000 roughly.
3,000 miles.
It's up there.
Yeah.
It was
And
quite
how
a
many
bit.
days did it take to get here? About 4
Well,
days?
doctor, my stress
Yeah.
level
Mm-hmm.
has calmed down a lot since I'm here.
It has,
But
yeah.
from there to here, it was almost nonstop driving. Almost like a semi-truck
Day in,
driver.
day out, like just nonstop.
Didn't want to stop. Only stopped to
Gas.
get some gasoline, get a little drink, rest my legs for 15 minutes, shut
just
my eyes for
back
20
on the
minutes,
car.
and immediately. That's why I showed up to your office early, like
Yeah.
4
yeah,
or 5
yeah.
days early, because
Right.
I couldn't take it anymore. I had to get
Understood.
here.
Yeah.
They talked me into staying in town, so I stayed there, and I trusted those doctors. Not the implant surgeon. He did what the prosthodontist told him to do.
telling to do,
He was
yeah.
following his advice.
orders, yeah.
His orders or treatment plan
Yep,
to
yep.
place the implants. I think there's like 20 or 21. I got a mouthful. If people want to see it up close, I'll show you. I have a mouthful, top and bottom, front
Well, yeah,
to
I
back.
can pull up the X-ray.
Mouthful of implants.
Yes. Yeah.
Very stressful on me to go around to my customers, even new customers. I get new customers 4 or 5 times a day. My
Right.
phone's being blowed up
Right.
because they're family members of a family member that I've done. They're relatives that moved from other states up to here. It's just I'm embarrassed.
Mm-hmm.
Luckily, I was able to wear a mask once in a while, but the mask, I couldn't do it.
Yeah,
It just
yeah.
it got to be ridiculous. So.
Right, right. So you have to present yourself to customers. I mean, you're still running a business. I mean,
Yes.
And so fortunately, I think because your customers have so much trust in you, you know, they're not judging you for not having teeth. But
No, not at
I think
all.
once we finalize the prosthetics and get the teeth in place, it's going to make a tremendous difference. It's
Big
going to be a
difference.
game changer
The
for you.
temporaries
so-
alone that you had in my mouth, even though they were.
Yeah, we
just
had to take
temporary
them out
to
because
look-
I needed to kind of
Sure.
use them to finalize the.
But I was
final-
so happy to have those in my mouth. I had not had
Yeah.
teeth. Yes, they tried stuff in Ohio, lasted days, and it would fall
So,
out.
so when they put the teeth in Ohio, how
Temporaries.
long did temporaries? even if
Temporary
they're
plastic,
temporary,
plastic.
So they were PMMAs. So how long did those last in your mouth?
5 days at the longest.
So what happened? They started to break or
They were
loosen?
cracking. They were coming loose. They came unglued from the abutments that are screwed up into the implants.
Yeah,
And that's not what I paid this man up in Ohio for.
understood.
I
yeah.
paid him. I have all the paperwork. I could have showed the pictures, but
It's all
of
good.
the treatment plan, what was supposed to be done.
Right.
I'm not naming names, not
Sure,
going that route.
Yeah,
But
we just want your journey, your history, and we want to make it known to our viewers because you're one of thousands of people that have been through this process.
And I did lots of research. I
Yeah.
did lots of research on the
Obviously.
oral surgeon. He's an oral maxillofacial surgeon. He's a good guy. He's a
Yeah.
good doctor, good surgeon. Lots of research on him. But I was sent to the prosthodontist by my surgeon.
by the surgeon, yeah.
And I thought, and I didn't know anything about the surgeon or anything about the prosthodontist.
Right.
So I thought the prosthodontist and my surgeon, I thought they were friends.
Sure.
So I didn't
right.
question it.
Of
I
course.
thought they
Well, if
thought
I
they
had
had
a
education
if I
together.
had a plumbing issue, and you said, and I needed an electrician, and you've got a somebody who you've heard or that's good at electrician,
True.
you would refer that electrician to me. It's no, I mean, you're not responsible for the electrician's work.
True.
But you referred me to that electrician, and because I know you're a good plumber. I'm going to just assume that this electrician is a good electrician, just because of our relationship in the plumbing world.
It comes back to my mouth there again. It's making me very hard to recommend anybody to a customer of mine. I tell them, you can get the book out or Google. I can't recommend anybody anymore because of what has happened with my surgeon recommended me to a prosthodontist that wanted payment in full before he even touched me.
Right.
And I'm devastated.
I know
my
you are.
brain, even sitting here, is it's like I'm thinking a million mile an hour.
I know.
of what I have went through, and
Yeah.
it has slowed down because
It
I
has
know
a
I'm in
lot.
good hands here.
It
You're
has a lot.
already making me stop. Any day here now, you'll have
Absolutely.
me fixed up. The journey is rough.
Yeah.
You-
What do you think about the concept of teeth in a day?
No, oh no. I've researched all that. Teeth in a day, all on 4, all on 6 is better than
Did they offer you all on 4
Whoa, they tried.
in the beginning?
They tried, but immediately
Thank goodness you're
absolutely not happening with me.
You have you're conscientious enough and have done
I did
enough
research. They fail.
to know that all on 4 is
It's
just
going to fail.
Not
It's
a good
going to
idea.
fail.
Sometimes they work. I don't want to say they all fail.
Most of it's all in the front. It's going to break. They're going to have more problems. Don't even go that route.
For your case, had they done an all on 4, it would have been an absolute failure because one of what you want.
Well, when I walked in the office, I told them exactly what because I already knew what I wanted.
Yeah.
On my surgeon's desk, they had like 10 different models.
Right.
Dentures.
Mm-hmm.
Dentures with a bunch of
With implants, snap-in dentures.
well, all that with the pink composite on it, down to a set that was number 1, and that's what I already wanted. I already knew it had no pink composite, beautiful white teeth, sitting on your gums.
On the gum, yeah. Mm-hmm.
With a mouthful of implants under them.
Sure.
Not 4, not 6. I mean, there was 10
Yeah.
or 15 or 20 plus implants on that model.
Mm-hmm.
And I said, that is what I want. That's why I'm here.
Right.
But even though I chose that, they still tried to offer me
The all on 4.
the all on 4.
Because that's easy. That's kind of the go-to for, especially for corporate implant centers. It's not as laborious, and it certainly doesn't take as much time. And
they do the same for everybody's
and
mouth.
the cost
is minimal.
a lot less.
A lot less.
Yeah.
For example, down here, just 2 days ago, a man said that his sister, family member, went somewhere and got for $18,000, got their teeth all fixed on some implants. And I said, it must have been an all on 4. And he had no idea what I was even talking about.
Yeah.
So anybody that's had root canals like I had done, veneers, where your tooth is shaved down and
Yeah.
they put a thin layer over it.
Crowns, veneers,
Crowns,
bridges.
over
You had
top,
a
all
large
the-
bridge on
like
one
bridges.
side.
You have to educate yourself because nobody's going to educate you. You have to do it yourself about what you want, what you
Yes.
want in your mouth,
Right.
what you feel is right for you.
Right. Because you have to live with it, right? I
For
mean,
the
at
rest
end
of
the
my
day.
life, I have to live with this. I've been living with toothless for 4+ years, and it has because the prosthodontist in Ohio kept telling me that he's going to make teeth,
Yeah.
and I didn't question him. But
Right,
I'd go up,
right.
he'd call me up, come up for a visit. and he's just
How
looking.
far away is
An
the
hour,
prosthodontist?
hour away.
So he's
from,
an hour from you.
hour north of Massillon. But as you can see, when I showed up to your office,
There's no teeth.
no teeth.
No teeth.
No teeth whatsoever.
Yeah.
Very hard to eat. My poor wife, to try to make food for me, she couldn't. Sad, very sad, to see her struggle with the food, because she had no idea that she'd make me a pork chop, or some bacon, or a bacon lettuce tomato sandwich, or a piece of pizza, stuff I would like to eat, and I didn't explain to her. She had no idea
Right.
that you're with no teeth,
There's no
that
way.
your gums do not go together to crush food. She goes, well, my grandmother used to eat steak and everything. I said, that's because your grandmother's jaws hinge was broken down from having no teeth and
She
in a
got
denture.
used to it, basically.
Used to it. You were, as you can see, the struggle I'm still going through.
I
The
know.
emotion, it's just. Very hard on me to control that. I could sit here and try to explain the journey,
I know.
but it really wasn't a journey. It was like going through the worst time of your life. The worst thing that you could imagine happening to you is being left by a professional and being left like this.
Yeah.
And I pleaded with him, put something in my mouth so I could eat.
Yeah.
Put something in my mouth. So he had a set of temporaries, lasted 5 days at the most. He tried several different sets. And there wasn't enough implants to hold him in the
Right,
back.
Right. Yeah.
So they were-
We've added implants.
Yep.
I hadn't met you yet, saw the x-rays, envisioned basically, okay, where I need to go with the case. So immediately had the oral surgeon in Ohio, because I figured it would be just easier. We could just get that part done. Add 4 implants right away, because I knew I wasn't going to be able. They had implants, basically.
I didn't want him cantilevered anyhow, and they knew this.
They had them. So for those viewing, I've added this implant, all the back implants I added, because otherwise we would have had to stop at the second bicuspid, and you still wouldn't have full function of your mouth.
There'd be a big space back there.
I mean, you've spent all this time, effort, money. You're now in dentures, or not even dentures, no teeth for 4 years. So I had to really regroup. And at the end of the day, your case was completely out of control. The surgeon had no control, and the prosthodontist had no control. So I knew that I had to get control of this and get you in a place, and it's not. And viewers, please know, it's not about boasting. It's about getting, and that I'm the only guy that can do this. That's not the case. But it's about getting Matt what he needs, so that when this is all done, he's done. And we've had to remove implants. We've had to add implants in order to, and all based on what he has. So had you come to me from the beginning, this process would have been a lot less expensive, and B, much more streamlined. Like, this would have been about a 3-month issue of wearing dentures, and you would be done. And again, I don't want any viewers or anybody to think I'm being boastful, but because I have the systems to take a case like this, and I've done it so many times, I've been doing this for 22 years, I just know what it's going to take to get a patient, do the original treatment plan the case, stick to that treatment plan, execute on the treatment plan, and get it done, rather than just going around and around. Even I've had to go round and round, adding implants and kind of doing a workaround of the work that's already been done. We're already on a good trajectory, a good path. But had I started from the beginning, we wouldn't be in, we wouldn't necessarily be in this situation. You wouldn't be, and you certainly would not have gone with no teeth for as long as you have, which that alone is a travesty, because for 4 or 5 years, every night you go to bed, every morning you wake up, this is the number one thing that's on your mind. Approaching new clients or new people that need your assistance or work on their house, whether it's going to dinner with friends, whether it's going to dinner with your wife, no matter what, whether it's a Christmas, whether it's Thanksgiving, whatever the case may
Terrible,
be.
doctor. Terrible.
This situation has affected every single minute of the last however many years.
Nonstop.
Nonstop.
And look how they left me look. Not only not having teeth, but there's no support for my
Your jaw,
lips,
your
for
lips,
my jaw.
Yeah.
Yeah.
I
I'm
mean,
not a doctor,
even
it's hard to explain,
to go 4 years with no teeth, even for example, this is just one, what we'll call in medicine and dentistry, sequela, cause. What's one cause of this is, for example, the nasolabial folds, the folds here. If you had teeth there and support in your facial structure and the muscles, in the bone, all of that wouldn't be so exaggerated, And so, to go with no teeth for so long, it affects your muscles, your facial structure, not to mention self-confidence and digestion and all of the other ramifications of not having teeth. So now versus having a case where, and I have to go back here. Let's look at a scenario. Let's see, live stream. Hold on. Let's look at a scenario where we were able to take the patient, and this is, so I gotta make this smaller somehow. All right, so here's a patient, similar situation, that we take him from A to Z. I see him initially, I diagnose the case, treatment plan the case, and take him from A to Z. Okay, so here's his preoperative x-ray, the before x-ray. All of these teeth have to come out. We'll look at some photos. So this is just a picture of his teeth. Everything's got to come out. There's just no question as to that. And here he is kind of after. We've pulled everything out, put the implants in. Again, here's a before. And you can see, like, there's just nothing left to save here. And, okay, so then here he is after the extractions and implants. And here he is about, this is 3 months later. So without having to do all these workarounds and kind of, he went from having lost all of his teeth within about 4 months. He was.
What kind of prosthetic is that?
Zirconia.
I mean, bridge work.
Bridge work, yeah.
or
Yeah.
denture.
It's bridge work.
Yeah.
It's all
Yes, sir.
bridge work.
Yes, sir.
Anyway, so
Okay.
my point is it doesn't have to be that way. And you can see there's no, minimal pink porcelain, but he had lost so much bone that it just wasn't possible to not have pink. But in the end, looks good, problem solved. He's off to the races and he's good to go.
My
So,
understanding, I had plenty of bone, correct?
yes.
Yes, I had plenty of bone.
Your case was a slam dunk. Literally, like without having to work around removing that implant that was in the
center,
midline,
correct.
Adding implants in order to design a prosthesis that's going to last you the rest of your life. All of those things were completely, manageable, so to speak. So, and not to believe.
You had a picture there of me, I think, that
Yeah.
had the temporaries in.
Yes. So here's kind of a side view here. So
And I like to see that, and there's a reason why. It makes me feel good
yeah.
just to see that.
To know that this is where this is you, this is
I'm
where
headed
we're
in the right direction.
We're headed in the right direction. Once this gets in place, problem solved, other than the lost 4 years or 5 years and the headache and the stress.
And people need to understand those were temporaries, but they were
Yeah,
beautiful.
Yeah, these are temporaries, yeah.
I was happy
And
with
we're-
that.
Yeah.
If I could have just kept them in my mouth, but I know I couldn't.
I didn't dare
You couldn't-
send you
can't keep
to
'em in there.
Ohio
No.
with plastic teeth,
No,
so that's
no.
why we're getting
So
it done.
now
So-
you're making me up a set of
Zirconia.
long-term temporaries made out of all zirconium.
Yeah, yeah. So
And so we'll have a picture of that here eventually, I'm sure.
absolutely,
Yes,
yeah.
sir.
So,
Yes, sir.
anyways, I just wanted to thank you for coming on.
And you can see the difference that there's some support from
facial
my
support.
mouth, the cheeks,
yeah,
compared to you have a picture that with no teeth in my mouth, correct?
yeah, and
Show it up close so people can see it.
adds, this literally.
Show it up
This
close.
makes you look about 15 to 20 years older.
And
This
I'm
is
already an old man.
not necessarily.
yes,
You got a lot of energy.
You let people
so.
see that mouth up close because it's absolutely is a devastation for anybody to have to go through this.
So this is the before, and I'm not real good with Google because I'm more versed in Apple. But so that's before.
You know, I've been laughed at. I've been teased.
And here's the after.
uh,
So
For not having teeth in my mouth.
yeah,
And I'm a grown man. You don't want to be teasing a grown man.
Yeah.
Okay? But, I withstood it and blew it off because it just wasn't worth my time
yeah.
to.
My last question for you would be, you said you got your first treatment done in 2017.
Yes, sir.
If you could go back to 2016, what would you tell yourself for all those who are getting into the what do I do with my
process.
mouth, the process?
Well, if I could went back to 16,
What
I'd have been
suggestions-
right here in his office, and he'd have done it from the get-go.
What suggestions would you have for those people who are in the process, thinking about or considering having this type of work done? Knowing how important this work is, right? I mean, it's life-changing.
It's absolutely life-changing. There again, I thought I was educating myself.
You
I
did. You
Lots
did
of
a lot
I
of
know
research.
quite a bit. If I wasn't so old, I would go back to college and I would become a prosthodontist and an oral maxillofacial surgeon. But I don't think I'm going. You never know how much longer I'm going to live. I'm in my middle 60s. Okay, I'm old.
You'd be good at it.
I
by
would
the
be
way.
very good at it because I'm very
Your
good with my
attention to
hands.
detail is very,
with plumbing,
very good.
What I could, everybody's different. Everybody's mouth is different. But what you need to know is that you cannot just rely on what a dentist is telling you, or a prosthodontist is telling you, or oral maxillofacial surgeon is telling you. You need to do research on each of those individuals. You need to see their background. You need to see their prior cases they've worked on. that's how I was educating myself. I wanted to see their work. I wanted to read about them, to learn their education, because it's a mouth and plumbing are kind of similar, but it's a human mouth. You can't. A
Yeah.
plumber's not going to work on a human mouth.
Right.
So I tried to educate myself, and anybody who's thinking about getting work like this done, you really need to
Do your research.
and educate, because
Yeah.
people are just going to tell you whatever they think they want you to hear.
Yes. Yeah.
You
yeah.
need to know and ask questions. Prosthodontist in Ohio, up north of Massillon, did not like me asking any questions. Matter of fact, he told me to keep my mouth shut. If I wanted him to help me, I was supposed to keep my mouth shut. Those were his words.
And what was the ultimate outcome with him up north in the prosthodontist? What happened ultimately?
He has kept all my money and not give my money back. Won't answer the phone calls. Won't return emails.
Did he? Was he willing to work on your case or finish your case?
No.
Why? What happened? Like, why wouldn't
Okay,
he?
I had a set of temporaries in my mouth
Right.
for 5 days. I thought everything was fine. They didn't look too bad, but they were PMMA, whatever it's
Yep,
called,
PMMAs, yeah.
which are just plastic.
Yes. Yeah.
The whole front, and they were individual bridges, 6 separate bridges.
Yes.
3 on the top, 3 on the bottom, all
Right.
screwed in.
Right.
I was eating, and the whole front bridge
Broke off.
started to it came out.
Yeah.
It just landed in my lap.
Uh huh.
So I called him. I was able to push it back up onto the abutment,
Sure.
but as soon as you touch it with your tongue or anything, or cough, or
Comes
sneeze,
right
it was right out of your mouth.
Right.
So I called him up. I said, the front bridge is loose. Can I come up? And she goes, well, I'll check with the doctor. Had to get back with you. So then they texted me back, come up a couple days later, whatever it was. And so I go, and I thought he was going to re-glue it back in. I thought he was going to glue it back up on there because it was just temporary. It's probably
Sure.
with temporary glue,
Right,
which I
right.
understand that.
Yeah.
They don't want to use permanent glue because he was probably going to reuse the abutments on the finals.
Right.
So they use temporary glue. That's what I would assume. As a plumber, I don't use temporary glue. Once something I glue is glued, it's glued. You got to cut it back out and start
Yeah.
over. So, anyhow, I get up there. I'm thinking he's going to glue it in. So he asked me a couple questions as he's looking in my mouth. He goes, tell me what you don't like about it. I said, well, it's sticking out a little bit over here. Needs some adjustment. I know they're temporaries. I'm not going to gripe at you too much. But when it comes to the finals, I don't want the finals to look like these. He said that the finals, when he makes, were going to look exactly like those temporaries. And my stress level just was
Shot through
out of the room.
Yeah.
Out of the room.
Right. Because you know what you want.
My blood
Like,
pressure
you're
was
very,
rising.
Very
Yes,
specific
he's
on what you
telling
want.
me that they're going to look just like the temporaries, but the temporaries needed all adjusted. He didn't adjust the bite. He didn't do any of that when he put them in my mouth. He just put them all in and sent me home. He didn't put the thing, I don't know what it's called.
Articulating paper, yeah.
The paper in your mouth, you tap
Adjust
on
it,
it.
make
It
the
leaves marks
adjustments.
on the other teeth. He didn't do any of that. Sent me home, came out. I went back up. He asked me what was wrong. I said, you need just a couple minor adjustments. So I thought he was going to glue it in. But he's unscrewing the abutments, took them out, the front, and he dug out the other holes. He had temporary stuff in the holes
Yeah.
where he just didn't even need a drill.
Right.
Matter of fact, most of the holes came out all by themselves, the little plugs he had in.
Yeah.
So he proceeded to
'Cause those are temporary plugs.
Right.
Yeah.
Which I understand that. He proceeded to unscrew all of them and sat them on the table. And he looked at me. He goes, Mr. Sturm, he goes, I want you to go home and ponder on this. And I thought to myself, what? He goes, I'm not working on you no more. That is the exact words out of his mouth. I am not working on you no more.
And you had paid him in full.
And paid him in full, over $50,000. I mean, that was a lot of money to take from my family,
Of course.
out of my business, from my home. It's just a lot of money. A lot of money for anybody. I don't
Of
care if I'm a
course.
business owner
Absolutely.
or if I have millions of dollars in the bank. $50,000 is a lot of money. But anyhow, so I said, Doc, what do you mean you can't satisfy me? He goes, this is the second or third set of temporaries. I said, well, that's the part of your process. You're supposed to try things and make sure that you get them to work. That's why they're called temporaries. You don't put finals in somebody's mouth and just send them home. You got to do temporaries and see if they're going. The bite's correct. I said, you didn't do the bite. You didn't put the articulating paper in my mouth. You
Which
didn't.
is critically important.
Absolutely critically
Because
important.
Just as a side note, when I do that phase, the PMMA phase, I make sure that the bite forces are evenly distributed throughout the entire
absolutely
arch
did that.
because that's what's going to protect the implant. So if I have, let's say for example, I don't do that, and I have one area that's hitting first, and it's just hitting in that one spot, I run the risk of overloading that implant or breaking the prosthesis because the load distribution has to be even throughout the arch form. When I have, like, when you have your own natural teeth, when you bite down, you know, it's evenly distributed, the bite force throughout the mouth. Otherwise, if I'm hitting just on one tooth, that's going to overload. It's going to push that tooth forward or out. You know,
And that's
so
exactly what was going on with the temporaries. But he didn't.
that's
You
probably
did that.
probably why they fell out, because the load
When you
factors
put your
were
temporaries
way-
in my mouth, you did that. You put the articulated paper in there. You seen the mark. You did what you did. Everything felt good. The bite was good. I was biting on evenly.
Yeah.
But he didn't do it, so he took them out. Told me he. So I said, Doc, are you really going to leave me like this? Are you going to leave me with no teeth? I said, first off, you ordered all my teeth removed, which probably did need removed, or I could have spent hundreds of thousands of dollars trying to save those natural teeth, which probably could have been done, but for the cost,
The long term,
it's better to do what I did.
it is
Absolutely.
because you could have spent literally hundreds of thousands of dollars, and 5 years down the road, and
that
you know,
was
if I
already
pull-
happening to me. You
yeah,
follow me?
5 years down the road, you would be literally in the same situation, and you'd have to spend, you know, again. So if I pull up your X-ray,
Doctor,
where
I
did it
have
go?
spent so much money on my natural teeth, trying to save them and having
Yeah.
the work I had done on them. I made a choice. I said, let's just do my whole mouth.
Yeah. So if you look at this X-ray, you know, you've got root canal teeth, you've got a large bridge. There's not a whole lot to save here. So I completely agree with their initial diagnosis of removing everything and putting in implants. You know, the question is, and when they placed those implants, they had they mentioned to you that this was a guided procedure, that they used guided surgery?
Well, no, when I first met the prosthodontist up north of Maslin, he gave me the treatment plan. It was over $50,000. And I kind of, anybody would kind of balk at that for a moment in their own mind.
Sure.
I said, Doc, over 50 grand. I said, just let me think about it for a little bit.
Right.
So, but I thought about it for a month.
Mm-hmm.
So, but I paid him. I paid him his money. Paid him full.
Yeah.
And he never really got started, but I paid him. It was supposed to be for, when he handed me that treatment plan with the over 50 grand price on it, and he seen that I was kind of in my mind questioning it, the cost. He made comments that some people would drive a Cadillac, some people drive a Bentley. I don't know what he was really meaning by that.
Sure.
He just made off-the-wall comments
Yeah.
of that nature.
But was the surgery guided? Meaning when they
Yeah, that's what I was trying to get to.
Did they tell you that
that's
they
what
did
I
a guided
paid
surgery?
him for when he handed me the treatment plan, I was walking out the door. He goes, that includes the planning, design, the planning and design of the guided surgery. It's supposed to have been a
Yeah.
guided surgery.
Right.
I never actually seen the guide. They never showed it to me.
Right.
There supposedly was some kind of a guide, but as you can see, when all the implants pictures that you have, the implants are real close together. They're not parallel. They're kind of just to me and it looked randomly placed in my mouth. So I questioned my oral surgeon about that.
Yeah. Yeah, it doesn't appear that this was guided. I mean, and that's I freehand all the time, but I
Well,
know
he does
what
too.
my
It's what he
plan
said.
is. You know.
But I questioned him.
yeah.
I said, why are they kind of all funny looking and why is the one in the roof of my mouth?
Yeah.
Because I complained about the one in the roof of my mouth from day one.
Right. Right.
It
right.
was, he goes, oh, that'll go away. I said, it feels ice cold. 24/7, it does not go away. He goes, that'll go away. So years went by. It's still, until you removed it,
Right.
it still
Yeah.
felt like there was a piece of ice cube up in the roof of my mouth.
Yeah, and it had to be removed because it wasn't useful. Like there was no way for me to utilize that implant, so I backed it out, and then I added one in a position that would be useful.
And I agree with that. I wanted it out of there. You
And
know
then
that.
we added the ones in the back. So long story short, you've been through a lot. You've witnessed kind of the A to Z, and like I say in my past live streams, you are a culprit or a beneficiary, not necessarily a beneficiary, but you have been affected by the system. The system is broken. You've got this, oral surgeon that's doing one part. You've got a dentist or prosthodontist doing another part. You fell in the middle and ultimately did not get what you thought you were getting because, like the analogy of flying to the moon, you don't really know until it's done. And then it's like, wait a minute, I wasn't expecting to take, this route that's not a straight directional route, to the final end result. And so you've had to come all the way from Ohio to California in order to get what you need. And
I
so
put my trust in that man, the prosthodontist.
yeah,
I put my trust in him.
yeah. You have no choice.
I
mean,
really had no other choice. I wanted to come out here 5 years ago almost.
Mm-hmm.
It wasn't really the money issue, but it was.
Of course, always.
It's the
yeah.
distance in between.
The
It
logistics,
was the
getting
time
here.
for me, because here it is. I'm 6 weeks out here in California, renting an expensive hotel.
Yeah,
My wife has to eat.
of course.
We had to have a place to stay. Gasoline's almost $7 a
I
gallon
know.
for premium for and I drove my work
Thank our
truck
governor for that.
with all my tools, thinking maybe if I drove my work truck, my tool, I could get some work out here and make some money. But
Right,
but
right.
there's a lot of plumbers out here. So, but anyhow, not only that, I had to stop working. My business is shut down because I don't let
'Cause you're not
anybody,
there.
I don't let anybody touch my work.
Right.
And there's a reason, because something's gonna go haywire, I will be blamed for it.
Yeah.
I will not let that happen
Right,
to me.
right.
My customers, they know me.
Yeah. You're a very honest guy, and you take pride in your work.
I
So
absolutely take pride in my work.
I really appreciate you coming on
You're welcome,
and
Doctor.
sharing your story.
You're welcome.
It's a very intriguing story, and hopefully it'll help people in your situation avoid getting into the same situation.
the trust
but we
issue
are
with you-
we are on a path and on a trajectory. The case is under control, and we are going to have this done in the next couple of days, and you'll be off to the races and get you good to go. So
I agree.
anyways, thank you, Matt, for coming
You're
on.
absolutely
I really
welcome, Doctor.
appreciate it. And
Thank you very much.
I'm Dr. Willardsen. Thank you guys for watching. Subscribe, hit that like button. It helps our YouTube algorithm to grow. I hope you enjoyed this show. We appreciate Matt coming on and sharing his story. If you have a similar situation, or if you have questions regarding your case, feel free to comment, or you can direct message us if it's, private message, and happy to help any way we can.
And I asked my prosthodontist in Ohio, because I knew something was going wrong.
Mm-hmm.
But I'm not a dentist. But I just knew something wasn't right. So
Something
I asked
didn't
him.
feel right.
Oh, for sure. So I asked him. I said, Doctor, if you're having a problem with my case, my mouth,
Let me know.
I want you to call Dr. John Willardsen in California.
Oh,
and his
yeah.
comment
That would
was,
never
I
happen.
absolutely did.
That would not happen.
Well, and what his comment was, it's too far away. Too far. I said, send my stuff out to him. He'll help you make whatever or
Yeah.
guide you along.
Yeah.
But he refused.
And I'm happy to do that. Most dentists, prosthodontists, oral surgeons are very filled with pride, and that just is not something that they would ever consider. But it is an option. I do have lots and lots of training and experience in this area, and happy to share any knowledge or any advice that I might be able to have, and happy to receive knowledge and advice from somebody who knows something that I don't, So, and that's kind of the disconnect, is there's no collaboration. There's not a community of doctors that really exists to where we can collaborate and we can build and grow together. It's kind of this, I'm in my foxhole and I'm in there by myself, and, but I am very confident in my abilities. So that being said,
There should be a collaboration with some doctors.
There,
they
yeah,
should be
for
able
sure.
to talk with each other.
For sure.
They cannot be embarrassed. Since they got so much education, the pride's taken over, you cannot do that.
Yeah.
If something's going on, you need
especially
to talk
today
with
with
each other.
all the technology that we have, and that we can certainly help the communities to avoid situations like yours, so that patients can trust the process and know that in the end of the day they're going to get what they expect.
He didn't
So-
even want to send me back. He wanted to send me. I was questioning about the implants placements to my prosthodontist who ordered them put there.
Yeah.
And I said, I want you to send me back to my oral surgeon who put them in. I want that removed out of the top of my mouth because I complained about it.
Yeah.
He wanted to send me to somebody else.
Right.
He wanted to send me to Clear Choice or Aspen
that would
Dental.
have been a big mistake.
That's what his comments were.
Clear
I just-
Choice is Aspen Dental.
Well,
actually.
yeah,
They bought
and my response to him was, would never happen.
Yeah,
If I'm
yeah.
going back to, I'll go back to the surgeon who put him in.
Talk to him.
And I've been
about
back there numerous times to my
it. Yeah.
surgeon.
and I've talked to him on the phone.
So
and
he's a
he
good
seemed
guy.
like a great guy.
He's a
So-
good guy.
Anyways, thank you guys for watching. We appreciate all of our viewers. And again, hit that subscribe and like button. And we'll see you next week, Wednesday, 9 a.m. Dr. John Willardsen. Visit trustimplants.com. Visit our YouTube channel, Trust Implants. And, if you've got questions, cases, remarks, feel free to add them there. And thank you guys for watching.